see you. Yeah.
Great. Hello, everyone. Welcome to Around Town TV Live. I am thrilled to have with us this evening Dr. Inell Rosario. Thank you for joining us.
Thank you, Carla.
For those of you who are maybe not familiar, you may have, or you may recognize her face. She's not only a top doctor in the Twin Cities, but she's also been featured on Around Town TV for several years and is on our current show. And I'm grateful that I knew a lot of you have a lot of hysteria and panic right now. So I'm grateful she was able to take time to be here with us tonight and answer some of your questions as well. Again, thank you. And I'll let you kind of take it over.
Yes, great. Good evening. And we are all a little worried because so much about the coronavirus is really unknown. We have, as been said multiple times in the news, there are vaccines for the flu. We kind of understand the flu. It's been around for a longer time. The coronavirus is very new, and anything that's new and causing mortality ends up being scary. However, I really want to emphasize that while this is a time for us to be vigilant, it's not a time to panic. When you think about it, if this gives you any, or I hope this statement will give you, or this fact will give you some comfort, in that when you think about the Diamond Princess that had over 3,500 patients or clients on board, and they were quarantined together, less than 10% of those patients over the succeeding or subsequent month actually contracted the virus. So even in close quarters, not everybody got it, less than 10%. Or even recently, the Princess Cruise Line, with all of those patients, all of those clients on board, 19 out of 1,000 crew members got it. So I say that to say, yes, we need to be vigilant.
Mhm.
Yes, we need to pay attention to um, minimizing the spread of the virus, but don't panic, just be smart. And so today, what Carla and I were talking about is some
Mhm.
of the ways that, as healthcare providers, but just general public, what we need to do to help protect ourselves and our families. And one of the important things that you're hearing in the news that the CDC is saying, that the Minnesota Department of Health is saying, is social distancing.
Mhm.
And what that means is really increasing the space between you and the next person.
Okay.
So, for when you're looking at some of the TV personnel, I think they had it on 60 Minutes tonight, where some of the staff of 60 Minutes had been exposed and tested positive. And so their limitation was you wanted 10 feet between you and anyone else you were talking to.
Okay.
And that was just for kind of the self quarantine. In general, for social distancing, we want you to put at least 3 feet between you and the next person. And that's so with a cough, with a sneeze, there's less spread of that droplet to contaminate the person next to you. So, really, social distancing is one of the first things that we can do to help decrease the spread of the virus. And
Okay.
this also includes just common sense things. If you're at the grocery store, you don't have to stand right behind the person in line. Give yourself that space. Um, you need your coffee. Make sure that you do. A lot of the stores have order online and pick up. Maybe wait in your car if there's a long line in, so that you're having less contact with the people that are around you. If you need the public transportation, then certainly carrying a sanitizer with you, washing your hands as soon as you get off the bus or off the train. If you are immunocompromised, you have diabetes, you have, a chronic illness, and you have to use a public transportation, then if you have a mask or gloves, then absolutely wear them to protect yourself. Because even though it may not protect 100%, having a mask on, if you're immunocompromised in particular, will certainly help to decrease the amount of a viral load you would inhale. And of course, the majority of your infection is coming by inhalation. That is why we tell
Ah,
you, yeah. Wash your
So it's not
hands.
okay. So do you have
Yep.
to touch though, or no?
No, we try to have you not touch your face.
But I mean, if you like had the germ on my hands and I touch my
Mhm.
face, I know eyes, ears, mouth, and nose, but is that the only way this virus can be or can it be through the air too?
Well, through the air, you're inhaling it.
Okay.
So you're then automatically inhaling it. If you have it on your hands and you touch your face, you bring it that much closer for it being able to enter through
Okay.
your nose or through your mouth or through a mucous membrane.
Okay. And I know you had a video that was out this past week that talked about the nasal area. Can we touch on that a little bit too?
Absolutely. So, from a nasal, actually, back up from
Hmm.
trying to minimize the amount of virus that you're exposed to. And this goes not just for the coronavirus, but any virus, any bacteria, any infection. Washing your hands decrease the amount of bacteria or virus on your hands. But you also need to think about washing your nose. So, rinsing out your nose will help to decrease how much bacteria your body has to fight. And so, oftentimes, you will get less sick. And this is something, as an otolaryngologist, we practice a lot.
Is that a
We
neti
see
pot?
a neti pot is great too, but
Okay.
it's a little bit more work to go and get your neti pot, get the water
Okay.
heated, and all of that. So just having saline spray, Ocean Air, Salinex, any of those things that are over the counter will help to decrease bacteria, virus, coronavirus included, that you inhale so that your body has less to deal with. I see that the shortage has been on toilet paper, and I remind people, if they've ever had children and had cloth diapers, do not panic. You will still survive even if you run out of toilet paper. However, I would say stockpile saline sprays, or any
Mhm.
medication that you need. For our sleep apnea patient, we tell you to get distilled water, or
Hmm.
certainly you can boil water for at least 5 minutes on high, and then let that cool, and you can use that to um, put in your CPAP machine or to make saline sprays. And on our website at Andros ENT and Sleep Center, we do have a formulation for how you can make your own saline spray.
Oh, great to know. So, for those of you who I've communicated with that have said, "Oh, I'm going to go get my neti pot, or I'm going to go buy one, or get mine out," this is actually easier, and and definitely can help you keep your nasal passages clean, correct, and which is important.
Yes, absolutely. I'm not sure I'm going to say easier, because
Oh,
if you're like
okay,
me, I much prefer to just buy it off the shelf and use it.
yeah,
But you certainly have options, and it makes
okay,
it affordable for everyone to be
perfect.
able to do.
And let me remind all of you, and I'm going to look down at some of my notes. I just want to make sure I have all the facts and I don't repeat anything incorrectly. The risk of the serious illness remains low for most Americans. There's been a 97, 98% survival rate of this. Everyone under 18, I don't think anyone under 18 has even contracted it yet. But the reason for the closure of the schools, the reason for the social distancing is because we don't have vaccines for this like we do for the flu, and we're just learning about this virus, and they're trying to delay, because we are going to see a big spike from what they're saying this week, or we could, and they're trying to delay that, which will help them be more prepared in our healthcare systems and to be able to test as they're going to roll all that out. Is that correct, Dr. Rosario?
I believe so. I do
Okay.
think that there are probably some people under 18 that have tested positive for it.
Okay.
Certainly, all of the mortality have been in the elderly or immunocompromised persons.
Right.
And so that is comforting.
Yes.
And, I think we just need to be smart about it. From a healthcare standpoint, this is what we've emphasized to patients for forever: wash your hands. To other healthcare employees and to employees in a restaurant: wash your hands. I'm just adding to it: wash your nose. And also, from a cough standpoint, because it is an aerosolized or respiratory borne virus, when you cough, don't just cough into your elbows, but also cough down and away. So if someone
Mm.
coughs straight into their elbow, and they're upright, there's still that spray of the virus or the
Oh,
droplets, I should say, into the air. But instead, when you
like a
do
math.
cough into your elbow, absolutely bend your head and cough down and away more
Okay.
towards your body, so it is not going as far up. And so someone standing near you is less likely to have that as high in the air for them to inhale, but the droplets are falling more on the ground. So definitely coughing when you have to cough, if you have to cough, even in your household around family members,
Mhm.
coughing into your elbows, but head down and towards your body so there's less droplets spread outward.
Anything like nobody in, I have two parents, which most of my viewers know, that are very immunocompromised with their chemotherapies and treatments. But none of us have any symptoms. None of us are coughing or sneezing or anything. But is there anything else we should be doing? Maybe I'm a carrier if I've been around somebody. Just that social distancing, even in the home, perhaps.
Yeah, absolutely. So, for you and what I've seen on the news and from the people that know a lot more about this than I do, if you have elderly parents, then minimizing your contact with them because they're staying home, but you're going back and forth,
Right.
and so you can have the virus and not have symptoms and pass it on to them. So all of these techniques are still good things, or measures I should say, are good things for you to do to help keep them safe, even though they're not going out and as much. And also just remembering, if you do come across someone that you felt was sick or may have had exposure to the virus, or if you're on the public transportation system, making sure you not just wash your hands, wash your nose, but also wash your clothes when
Yes.
you come
Yeah.
home. So, changing your clothes more often, leaving your shoes at the door so you're not
Okay.
tracking it throughout your home. Opening the windows when you can so you can air out your home. Or if you're riding in the car with your parents, maybe rolling down the window so that the concentration of your viral load isn't affecting them as much.
Ah, good point. And for those of you who are just tuning in, I have a top doctor in the Twin Cities, Dr. Inell Rosario, who has been kind enough to join us. She not only has her practice at Andros ENT and Sleep Center, as well as audiology, she has a med spa as well. It actually was, and I can say this, I know you can't, is my mom's personal surgeon, not only for her ears, but she is her ENT as specialist as well, and just really wanted a specialist, a person who can help you. I wanted to help a lot of you relieve that panic and that fear and that hysteria that is out there that the news and the media has created, by just giving you the old school journalism, the facts. If many of you in the coming weeks maybe are going to go and get tested, or you'll have symptoms and maybe you won't test positive, but if you have symptoms of a virus, you are still contagious. So everything Dr. Rosario is sharing with us is important to follow, no matter whether you have the coronavirus or not. Just everyday common sense. Is that correct?
Absolutely. And, this hopefully, well, it has been made into something political. From a medical standpoint, we are here to help our patients, to try to keep our patients and the community safe.
Mm-hmm.
As medical providers, we're on the front line. Our office is open. We do screen patients, however, and wanting to see that if you have a cough, if you have a fever, if
Okay.
you're feeling short of breath, or certainly if you have traveled to Europe in the past 2 weeks, or have had contact even with
Mm-hmm.
someone who has traveled to Europe, Asia, Ireland, England in the past 2 weeks, then we would ask that you call, and we're more than happy to take care of you over the phone just to minimize our risk exposure um, to our
Mm-hmm.
patients, other patients, and as well to our staff. And in the office, for the patients who do come in, we are doing the social distancing, so to speak, so
Mm-hmm.
that within the waiting room, they will be seated in quadrants that are more than 10 feet apart and immediately roomed to minimize any common area gathering.
That is fantastic. And from a lot of the research I've been doing today, just by listening to the task force speak through the live streams, sounds like this week they're going to roll out with providing or access to over 2,000 labs for testing centers, as well as already in over 10 states, they have the drive-through of the testing. If
Yes,
you
that's
have
great.
okay, and if you have Medicare and Medicaid, your copays will are null and void. You will not have to pay a copay. If you are somebody who is uninsured but need to be tested, you will not have to pay. They're starting to roll that out. A website the beginning of this week where you can go through a series of kind of a survey to see if you fall into the category, and it will guide you. So watch for this tomorrow morning as well as tomorrow afternoon. There'll be more live streamings. A lot of those links will go live even through social media, but you could always turn to some of the news stations because this has been made into a little bit of a, well, quite a bit of a political thing. Not all of them are even sharing this useful information that you need, which is why I am so grateful that you've been so gracious to share your knowledge and expertise and to give us some more guidance. What else do we need to know or that you think is important that you wanted to share with us?
Well, the good news is that right now, as of 5 minutes ago, all of the hospitals in the Twin Cities are doing essentially business as usual as far as
Okay.
surgeries.
Okay.
So elective surgeries are still going on, and so are obviously emergent surgeries. And so, from a hospital medical profession standpoint, doing sterile processing, being able to handle patients who are sick is an everyday thing. This is obviously ramped up, amped up quite a
Mhm.
bit.
Right.
Today or tomorrow, we expect to hear news from the Fairview and Alina systems as to whether or not they will change having elective surgeries or not. But as of right now, I have surgeries on for tomorrow and this week, and I've gotten no indications that any of those cases will be canceled.
Okay.
So I think for the most part, what we're wanting patients to know is that we are prepared. We do social isolation, social distancing, we have sterilization processes in place to be able to handle this.
Okay.
And again, just really think of all the people quarantined. Despite what you might think of the quarantine, wouldn't have been my choice, but people quarantined together on a cruise ship. And even in
Yeah.
that high concentrated environment, about 10% of them got sick. And so that's really hopeful news, and
Yes.
hopefully helps to, calm the fears of people when they think about the spread of it. But like was said on the news today with the president and vice president's press release, it certainly will get worse before it gets better as more people get tested and develop the disease, especially as more people come from abroad back to the
Mm-hmm.
US. We're going to
Mm-hmm.
see a spike before we see it leveling it out. So, again, just think, 3,500 people on a cruise ship, and about 350 got it over 3 weeks almost of being quarantined together. So hopefully
That's
that
pretty good.
provides some comfort. And again, just being smart and trying to
Right.
avoid, um, well, I don't think there will be any large gatherings, but certainly
Right.
trying to avoid, congregating in big groups together. And right now, I think it's gone down to groups of 50, and
Yeah.
it may go below that, but
I
just
agree.
yeah.
Yeah. And for those of you hoarding toilet paper and everything, the grocery stores are not going to close. They've made
Yes.
it very
Yeah.
clear. None of them are going to close through this process. They're asking us to not come and buy them out
Yes.
because of that. And if you're one of those people who's going to buy all the hand sanitizers and things and you think you're going to go sell them on Amazon, Amazon is shutting those people down. So don't do that either. Don't
Yeah.
take them from everybody. We need that to keep things sanitized to help keep this at bay, which is why they're taking such drastic measures. So because we are now going to see this spike, but they've held it at bay. They've delayed the spike by closing the borders from China January 31st. And they are saying now, and we were talking about this, we don't know, but they're saying as a result of doing that, this would be as bad as Europe if they hadn't done that. and it will delay it. Yes, we're going to think, oh, this week it's like horrible because of now all this testing's available, so people are going to test positive. But in a couple weeks, we should be like some of the other areas in Europe where they're opening back up again.
Yes, looking forward to that. But, we still need to be vigilant. And again, if you've traveled to Europe, if you have symptoms of fever, cough, shortness of breath, those are the people that we're wanting to be tested, and they can contact their primary care doctors or the Minnesota Department of Health, or even going on the Center for Disease Control website and finding more information there as to how to go about testing in their local areas.
No, there's a lot of people that are kind of taking the extreme measures of they're not going out, they're quarantining themselves, even if they haven't been around people. They're social distancing themselves if they absolutely have to go out. And then I've got the other extreme. Well, I have the family vacation planned. I'm going, or I'm going to live my life. I'm going to go to all my meetings and things like that. And like you, I haven't had anyone that's really wanted to do. One client has wanted to do a Zoom meeting this week. Otherwise, it's business as usual. Should I be more like wanting to pull back on that, or should all of us that are kind of living their life normally be pulling back a little more?
Well, I think we all need to still live life because it is stressful, but I think we need to be smart about it,
Okay.
and certainly protecting the rest of the public. If you have been with any exposure, if you have symptoms, then please pull back and,
Mhm.
stop the spread of it. But if you're otherwise feeling fine, then I think, use your best judgment. But smaller gatherings, having lunch with a friend that's also you trust to be um, someone who's not had exposure, secondary exposure. But even after those incidents, washing your hands, washing your nose,
Mhm.
changing clothes, all of
No
those
hugging
things,
or
I think.
shaking hands, right?
Yep, absolutely.
Okay.
The elbow bumps or
Okay.
leg bumps or any of those things, knee bumps, and just, yeah, not handshaking at all, I think would be helpful. But
Okay.
in a movie theater, I know the movie theaters have gone to half capacity, and I would say it should be like in every other row, or maybe every fifth person, every fifth chair being occupied, so that
Mhm.
there's less contact, so that there's the
Mhm.
social distancing there. A lot of churches have gone to online, and those are all smart things. For what you can avoid, then definitely do avoid.
Okay, that's great advice. There's been a lot of people online watching this and then jumping on and off this whole time we've been on. We've been on for about 23 minutes. If somebody has questions or they need to reach out to you, whether it's for ENT or sleep center audiology or just about this coronavirus in general, should they go through your Facebook page that will be tagged in this? Is that the best?
Um, Probably the better way would be to go to Dr. Rosario at androsent-sleep.com and or
Okay.
contact their primary care clinic. We'll be updating our patients essentially daily, and certainly reaching out and calling all of them to answer their questions. And for our elderly patients, making sure that we have some special hours if they really need to come in, so that they come in at a time when there isn't anyone else in clinic. So a little bit of a concierge service for them.
Okay. Can you say that again? That Dr. DRRO.
Sario. So Dr. Rosario. So
Okay.
DRROSARIO at
Yep.
Andros,
Mhm.
ANDROSENT sleep.com.
Okay. And I will post that in this as well so that you all have that. So you actually have access right to Dr. Rosario to get directly to her to have your questions answered. And gosh, I so appreciate, like I said, you taking time. You have such a busy schedule. Anything else that we haven't covered that you think is very important?
No, I think we covered it all, and have people just, pay attention to the news and maybe watch a few different channels so that you get a broader perspective on, what you should do. Your employers will be contacting you, I'm sure, and the different
Mhm.
school districts. And the thing that, oh, I did want to mention, making sure I was at the store and I was surprised to see how much fruit and vegetables were still there. Well, when you're sick, you actually do want those fruits and vegetables. So don't forget to take your vitamins and get fresh fruits and vegetables and drink lots of water. And yes, you still need to sleep.
Yeah.
And I know that's going to be disrupted by all the stress of the virus. But
Mhm.
make sure you're trying to get your sleep so that if you do get sick, you have the right immune building blocks in your body to combat it.
So less toilet paper and more fruits and veggies, everyone.
Correct. Yes.
That's
And more
great.
saline nasal sprays.
Yes, yes.
Yes.
And I know that there's a lot of us are communicating both on apps through the next door neighbor, it's called, as well as on social media, figuring out who is out of what. Friday night, my family, well, I was out of town, did go to Lunds and Barley's, and they had everything, including TP. So,
Great.
and they did talk to them, except for a few of the hand sanitizers, but they're trying to stay stocked up. And what they're telling us is, please don't hoard it. They're
Yes.
going to stay open no matter
Yes.
what, no matter how bad this gets. So,
Yes. Yeah.
yeah.
And so for all the workers that have to go to work at
Mhm.
those stores, at the companies that are making masks and all of, the essentials, then it's even the grocery store workers, those are very essential so that they keep things stocked. They are still getting that exposure. And what we talked about today is absolutely crucial for them as well to minimize their ability to or their risk of contracting the virus. And, we have lots of healthcare workers on the front line. And, unfortunately, us too will have a risk of getting that. And so,
Mhm.
all of these things that we practice are really important to help minimize the impact of the virus and the spread of the virus.
Yes. And it's simple things that Dr. Rosario's been mentioning, from even when you're getting into the elevator, use your elbow, don't use your fingers.
Yep.
I wear gloves. I don't touch the doors if you can,
Hmm.
even the bathrooms, or wash your hands and make
Hmm.
sure you use that paper towel to open public doors. Carry wipes with you if you can, or hand
Absolutely.
sanitizer. You can't be, I've done that for the last decade, not just because my parents both have been on chemotherapy and treatments, and specifically my mom the longest. I used to get sick a lot with colds and viruses. And ever since I've been doing that over the last decade, knock on wood, I rarely do. But I did just catch the flu, a form of the flu, but I was down for 16 days in January, and had that fatigue, and so you can't be safe enough. And then my parents didn't get it because I did stay away from them. I didn't touch things they touched, or so it's just being smart.
Yeah, perfect. And this is also a good reminder to get the flu shot. So
Yeah.
this is we don't have a vaccine for the coronavirus, but we do have vaccines for the other forms of flu. And so, definitely get the flu shot if you haven't gotten it, and remember in future years to get it so that you have fewer viruses that you are more likely to get. And because who knows what'll break out in
Right.
15 years from now. But just that reminder to listen to those preventative measures of getting the flu shots, of being
Mhm.
safe.
One of the people that has been watching her, Colleen, said, "Will a vaccine be made soon?" Are you aware of when they're working on?
They are working on one, and I don't know when it would be available. Typically, most vaccines take closer to a year. I did hear a report that they transfused one patient that was really sick with the blood of someone else or the plasma, I should say, of someone else who had recovered from the vaccine, wanting to get those antibodies
Mhm.
in. And I haven't heard an update yet as to how the really sick person was doing.
Well, and I don't, maybe you can clarify this. I've heard that there's been unprecedented speed or historical speed getting things through the FDA. Is that what they're focused on? Is this
That
vaccine?
is what they're focused on. Yes.
You guys, that does usually take a couple years. That's what my dad does, is get things approved by the FDA. And when they were talking how quickly this has happened, it's like they're working day and night to make that happen.
Yeah. And it
So,
affects all of us. So,
mhm.
yes.
Right, right. Great. If again, we still have a lot of people online, but before we close, if we've covered everything, I will again put her email in there so you can reach out to her directly. Gosh, Dr. Rosario, I'm just so grateful to you. Thank you for all of the life-saving insight tips to this crazy disease and the craziness that's out there.
Absolutely. And again, I just want to close with saying a lot of things get kind of highlighted, but wash your nose, sneeze into your elbows, but down and away. So away. There we go. Yes.
I'm sitting up higher because I'm so short.
Perfect. That's
Yeah.
okay. Good.
That's great. And if you want to learn more about Dr. Rosario and all of her companies, she's featured on Around Town TV, which is on all of our new medium, social medium sites. And you can watch her not only on MCN6, but right here as well, and learn a little bit more about that separate from the coronavirus, because I know we're all kind of tired of it, but I also know there's been so much hysteria and panic. So thank you again for calming us down. And yes, like one of the people just wrote, crazy times. It is crazy times, but you're helping us keep that in perspective. So thank you.
Absolutely. My pleasure.
All right. Well, we'll close the show out now. Thank you all for tuning in. I'm Carla Berlin with Around Town TV Live with top doctor in the Twin Cities, Dr. Inell Rosario. And we will put her information so you can email her directly. Thank you again. And I hope that you have a wonderful evening. And I hope all of you watching have a great evening and are able to have a little more peace from this interview.
Absolutely. Take care. Have a good
Thank
night,
you.
everyone.
You
Okay.
too.
Bye.
Bye-bye.